Good afternoon, this is Dr. Do again. This video is for alphabetic list for problems. What kind of problem you need to go to an emergency, what kind of problem you need to see a physician, what kind of problem you can manage home. We're on the C list, so today I'm going to talk about COPD, chronic obstructive pulmonary disease, very common, commonly heard, probably your family members, your grandparents might have it. Basically, what are the COPD? COPD classically including the chronic bronchitis and emphysema. Recent years, some of the books including asthma belong to the COPD, which is reasonable because asthma itself causing the constriction of the respiratory trachea, so that's caused obstruction. So that's reasonable. So three categories. What are the signs you need to see the emergency room? For chronic bronchitis, of course, I have talked it before. Coughing becomes worse and feel difficult breathing and profound amount of sputum, especially when the sputum change color to the green or yellow, and high fever. So that's the case. See your physician or go to the emergency room. For the emphysema, the worst scenario is the heart failure, which is called cor pulmonale, a special name dedicated to the COPD caused heart failure. These people usually have the hypoxia severe, getting worse, and has the difficulty breathing, especially at night, called nocturnal dyspnea, which means waking up at night, run to the window to gasping for air. This is a sign of congestive heart failure. And also sometimes you need to elevate the pillow in case, because the fluid back up to the lung, because heart failure and fluid accumulate in the lung, so that's why have to sit up or high pillows in order to breathing well. So if this is the case, and of course associated with either fever or cyanosis, these are the signs to go to the emergency room. The point is, for the cor pulmonale, the COPD caused heart failure, usually it's time to recur. You probably know it. There are many patients come to the hospital with heart failure and treated and discharged, and a couple months later come back. Because of this, this situation is chronic, irreversible. So manage at home, follow your doctor's advice, comply with doctor's prescription that will decrease the recurrence. So keep healthy. And of course, asthma, acute exacerbation, feel difficult breathing, go to emergency room, particularly for those, even though you have the inhaler does not make you feel better, or you're out of it, go to the emergency room. Maybe something like the steroid, systemic steroid, and put more stronger or long-lasting or quick-acting inhaler can improve the oxygen situation. So these are the signs to see the emergency. Anything you can manage at home. Basically, what I mean by manage at home is using some over-the-counter medication. For the COPD, there's no way it can be done in that way. You cannot manage at home. Have to be prescribed, have to be treated with prescribed medication, either asthma, chronic bronchitis, or emphysema. So this is the COPD that has to be managed by a physician. Usually this follow-up, if you're diagnosed with COPD, you see a physician is on a regular basis. You know it. So let's talk about the mechanism for this COPD. Chronic obstructive lung pulmonary disease, as name implied, the obstruction of the respiratory system, either lower, pretty much the lower respiratory tract, is obstructed either by the inflammation for the bronchitis, emphysema, or by like asthma by the constriction itself caused by the chemicals secreted in the respiratory system caused bronchi or smaller bronchioles constricted, that caused obstruction, so difficult to breathing in and out. At the beginning it's difficult to breathe out, later on both ways. For the COPD emphysema, because of the air cannot expirate out, so the alveoli is expanded and the lung expanded, so the chest is kind of in the shape of barrel shaped. Okay, so this is and there's another cause for the COPD emphysema, which is genetic enzyme deficiency. If that's the case, I'm sure your doctor already told you you have this genetic disease, had risk for emphysema, and you managed accordingly. Okay, so what is the mechanism for heart failure? Basically, because the air accumulated, retained in the lung, which increase the pulmonary pressure, which is pulmonary hypertension. So just like the systemic high blood pressure, if it's long going, the pressure cannot be controlled, develop the heart failure. It's the same idea. Pulmonary high pressure in the pulmonary artery, which is hard to manage compared to systemic hypertension. So the long-term pulmonary hypertension pose the risk, or eventually exhausted the heart, cause the heart failure. So what are the signs of heart failure? I already said, coughing up the difficult breathing, of course. Those at night couldn't sleep, elevated the pillows and running to the window, gasping for air. Cough up the filmy pink sputum, or sometimes if it's worse, can get lower extremity edema. All of those are the signs of heart failure. Like I said, cardiopulmonary is kind of recurrent. It's tough to manage. It's basically, even though symptomatically feel better, the fluid is gone, and later on high rate to re-hospitalized. So what I'm saying is the significant for this video is the whole take-home message is prevention for those people, particularly long-term smoker. Think about this end stage of cardiopulmonary and heart failure. It's very painful. It's a very high rate of mortality, and also the smoking itself, either remote or recent, will make difference if you stop smoking, right? So that's the sign, especially for young people. If you're a smoker, consider this probably years later. This is the condition is related to the smoking, and also of course lifestyle. And for the bronchitis, chronic bronchitis, manage, follow physician's advice, compliant. If you need to be treated with antibiotics or the inhaler, or whatever the medication you were prescribed, take them, follow them. So just decrease the end stage complications like heart failure. And also the signs are already mentioned. I'm sure your physician already told you what are the warning signs you need to see the emergency, and follow up with your physician regularly if you're diagnosed with COPD. So this is a very touch basis, superficial, general idea, general educational for those people particularly do not have the COPD. Because for the COPD patient, you probably know, your physician already talked to you and you know it. But for those currently do not have it, hopefully this video will help you to understand the complications of long-term COPD, so then you can start early to prevent it, and also to exercise, healthy diet, to pay attention and do something good for yourself. especially quit smoking. So that's the significant real change, will decrease mortality, will change life. So this is the video for COPD. Thank you for tuning in. I'll see you next time.